For many individuals with disabilities, going to the doctor is a frequent part of life. Yet many face challenges and delays getting the care they need. In 2016, the U.S. Department of Health and Human Services reported to Congress that individuals with disabilities experience health disparities. The report notes that as a group, individuals with disabilities experience worse outcomes and are less likely to receive recommended care, that they are less likely to have had recommended health screening tests, and they often do not receive comprehensive preventative care.
When you look at just routine primary care, just access to care, people with disabilities are much less likely than someone who is typical to receive just these routine types of things.
The federal department is addressing these challenges by setting a priority to eliminate health disparities affecting people with disabilities by 2020. Here in Colorado, Health First Colorado, Colorado's Medicaid program, is making disability competent care a priority by aligning our initiatives and strategic plan with the federal goal. An important part of meeting that goal is ensuring the equitable delivery of disability competent care throughout the healthcare system. This video series is one component of achieving that goal. Health First Colorado has created this series of short videos to help you understand disability competent care. The first three focus on the what and why of disability competent care, while the last three go deeper into how to implement changes in three key functional areas. You can choose to watch one or all of the videos in any order you select. Each is from 5 to 10 minutes long. For many providers, disability competent care is a cornerstone of their practice, and there are a lot of good reasons for that.
One is, of course, it's the right thing to do. People with disabilities need great health care just like everyone else does. So all practices want to grow their customer base, see as many patients as they can.
This is not a small patient population. So chances are you already take care of people who have disabilities in your practice.
People with disabilities often have lots of conditions that may be different than the way you've seen these conditions present in other patients. So just from an intellectual, professional point of view, it can be very interesting working with people with disabilities.
While the traditional medical model focuses on a person's medical problems, disability competent care is based on recognizing and treating every individual as a whole person beyond their diagnosis or conditions.
So when we talk about disability competent care, what that means is that our building, our people, and our attitudes toward taking care of patients are going to provide great care for a person with a disability.
It's also talking to the patient and understanding, hey, how can I help you best? You know, is this somebody that needs assistance with communication? Is it somebody that needs assistance with mobility? Are we addressing those needs?
In order to deliver disability competent care, providers and their staff need to understand not only the patient's disability experience, the clinical diagnosis of the disability, and the functional limitations that person may face, but also the individual's goals and priorities for their health and their life.
It's always a focus on how is your disability, not how am I doing, what am I doing. Once or twice I've had a doc actually say, hey, are you doing more activities outside? Are you enjoying the outdoors? You know, what are you doing? And to me, that was like a turning point. I was like, hey, thank you for asking. So I did go kayaking, I did go adaptive paddleboarding.
So let's talk about why disability competent care is so important. According to the Centers for Medicare and Medicaid, in 2013, more than 22% of U.S. adults reported having a disability. Mobility-related disability was the most frequently reported type at 13%. And consider that in the 2010 Colorado census, members of the baby boomers generation numbered 1.3 million. Over the coming years, these individuals will reach their 70s and early 80s, with projected growth of 61% of those over 65 between 2010 and 2020 alone. For providers, that will mean both an opportunity to serve that growing population and an obligation.
And as medical technology and medical treatment advances, more and more people living with significant illnesses are living into adulthood and living full lives. In the 1970s, people with Down syndrome only lived to be in their 20s. Now they're living into their 60s. People with cystic fibrosis are living longer. People who have spinal cord injuries are living longer. So all of these people are part of our community. They're part of the people we want to serve and need to serve.
The Americans with Disabilities Act of 1990, the ADA, requires that healthcare providers provide individuals with disabilities full and equal access to their healthcare services and facilities. So, there are legal reasons to make sure your practice or clinic is compliant. The challenge is that many providers think only in terms of physical access, such as ramps and grab rails, to achieve compliance. And many think providing disability-competent care is cost-prohibitive.
Especially for people with physical disabilities, being able to do a really comprehensive physical exam that can help you make good decisions moving forward, I think a lot of doctors are intimidated by that. So if you have someone who comes into your office with a lot of equipment, in a wheelchair, for example, or your exam table doesn't go up and down or isn't able to accommodate a person of whatever size that they are, that's actually dangerous to get them up out of their wheelchair. But if you can't do an exam, how am I supposed to know what's going on the parts that are sitting in the chair?
Working with the attitude of your staff, the competence in speaking to and about people with disabilities really doesn't cost anything at all. Even if you're in a very small office with only 2 or 3 examination rooms, you don't have to have tables that lower down to chair height in all 3 rooms. But what about just having one? A lot of the things that we're talking about getting to take care of people with disabilities are going to be good things to take care of lots of your patients. In order to take good care of your patients, give them great care, and protect yourself, you need to be able to examine patients with disabilities in the same way that you would examine other patients.
Individuals with disabilities are often loyal customers. When they find a provider who accommodates their needs, they tend to stick with them for the long run.
So meeting us and showing us and treating us as just like everybody else is something that wants me to come back to this doctor.
Word of mouth spreads pretty quickly in the movement, the disability movement.
Their whole facility is really set up to cater to people like me with special challenges, just a really kind of great facility for that kind of thing.
I have had some good experiences with my medical care, mostly because I have had doctors, specialists, and therapists that have known me a long time. They listen to me and my parents and are always friendly whenever I see them.
Improving disability-competent care builds trust and enhances not only the experience patients have, but the experience for providers as well.
This is why I went to medical school, is to try to help people. And when someone with a disability comes into my practice and I have the opportunity to make a difference in their life, improve their health, then I've done a good thing, and that makes me feel good at the end of the day.
This video series and the accompanying materials are meant to give you information and tips. They're not intended to supersede the requirements found in the Americans with Disabilities Act of 1990. As you begin to assess and make changes in your practice, it is important to consult the ADA for precise requirements.